Well, yet today, after talking about this for, 40-some-odd years, I still get people saying, "No, come on, doc, my doctor says," it's always my doctor says, "I can get everything I need just from eating well. Why do I really need a supplement?" Well, for references, I'd urge you to get a hold of my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Rare Earth Bin Cures, and the book Epigenetics, as I said, in the book Immortality. Those 3 books will actually show you in great detail with references why you need a supplement. That basically, you're not getting the same minerals that your grandparents got because you're not using wood as fuel anymore. At 3 o'clock in the afternoon, Monday, September 4th, 1882, our traditional source of nutritional minerals went away after thousands and thousands and thousands and thousands and thousands of years. 3 o'clock in the afternoon, Monday, September 4th, 1882, on Pearl Street in New York City, on the bluff overlooking the construction of the Brooklyn Bridge, Thomas Edison pulled the switch on the first commercial electric generating plant. Within 10 years, every municipality, every town, every city in the industrialized world converted from wood as the universal fuel to electricity, and that was the end of our supplementation. Here comes doctors. Oh, you get everything you need just by eating well. Well, just what do vitamins and minerals, amino acids, and fatty acids do for you? Well, they're called essential nutrients because you can't make them. You must consume them every day because they have really hundreds, and each of them have hundreds of functions in your body, the biochemical, the hormone, and the chemistry levels, enzyme levels in your body, in every cell. They have functions, okay, to maximize your genetic potential for longevity, for health, for maximizing your genetic potential for fending off disease, speed, and strength and intelligence. You need all 90 essential nutrients in the 90 for Life program. Here's why. Well, let's see here. Vitamin A has hundreds of functions, but basically, here's one you'll understand. You're going to go night blind. You won't be able to see at night if you don't have vitamin A. You'll get keratosis. Your skin will feel like sandpaper. Okay, but worse yet, your intestines get the same way if you're missing vitamin A. What about B1? Vitamin B1, you're going to get a disease called beriberi, which is only found in third world countries, according to American doctors. But guess what? It's the biggest single cause of heart death in America is beriberi. The terminal event of beriberi is congestive heart failure. And then B3 deficiency causes pellagra. Pellagra caused the death of thousands, as I guess it's thousands a day, millions of sailors over a 100-year period during the days of the sail. And then vitamin B12 deficiency, of course, gosh, you're going to get pernicious anemia if you don't have vitamin B12, or if you don't have stomach acid, which is made by chloride from sodium chloride, salt. And who tells you to give up salt? Oh, doctors. That's why we have so much reflux, because you don't supplement with salt like you're supposed to. And then vitamin C, scurvy. There's another one. We can prevent and cure scurvy with vitamin C. Vitamin D, you can prevent and cure rickets with vitamin D. What about K2? Well, everybody knows you need vitamin K for blood clotting normally, but also it has to do with bone metabolism. Calcium has 147 different functions: osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, bone spurs, kidney stones, blood pressure problems, insomnia. These are all caused by calcium deficiency. And then let's see here. Potassium. If you're deficient in potassium, your heart can stop. That's not good. And then selenium deficiency causes things like fibromyalgia, liver cirrhosis, lupus, things like muscular dystrophy, cystic fibrosis. And then, of course, zinc deficiency causes all kinds of birth defects, including stuff like missing fingers and toes, missing legs and arms, heart defects of all kinds, and birth defects. Let's see here. What about omega-3 deficiencies? There's a fatty acid deficiency, omega-3 deficiencies. We're looking at abnormal blood clots. We're getting 2-year-olds now who are dying from stroke, thrombotic stroke of the brain. They're getting a blood clot in the brain. 2-year-olds. That's because you're not getting omega-3s. Our original source of omega-3s was, egg yolks. You can't give your kids egg yolks, according to your doctor, because of cholesterol. Fire the doctor and give your kids 2 to 3 eggs a day, soft poach, soft yolk, soft scramble, and butter. Stay away from, of course, oils. Copper deficiency can cause everything from spider veins, varicose veins, hemorrhoids, varicose veins in a funny place, and aneurysms, loss of hair color, vitiligo, loss of skin color, connective tissue problems, including joints, cartilage, ligaments, tendons, connective tissue. And I could go on and on for all 90 essential nutrients, okay? You can get hemolytic anemia, where your red blood cells just fall apart because you're vitamin E deficient. I could go on for all 90 essential nutrients, but I want you to get a hold of the books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Rare Earths, Bin Cures, and the book Immortality, and learn how these 90 essential nutrients are going to add 25 to 50 healthy years to your life. Okay? Because remember, your genes, your DNA, your RNA, and your telomeres, the little end caps on the end of your chromosomes, require these nutrients. Now, we have to be careful what we say in certain things, right? These are all, everything I've already talked to you about, even medical docs, if you read their textbooks, they talk about these deficiencies. But if you start getting beyond that, you have to use what's called structure-function claims. We can support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue by supplementing with certain nutrients. We can't cure arthritis. We can promote and support maintenance and repair. You have to use the right language. Stay on the rails. Get a hold of the book Epigenetics, the book Rare Earths, Bin Cures, and the book Immortality, and learn how the 90 essential nutrients are going to add 25 to 50 healthy years to your life. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a bit about medical mistakes, as I have a news story here that I got from the San Francisco Chronicle, and the headline reads, "Mistakes all too common when setting children's broken bones." And they say that childhood fractures are common, especially among boys. They say the injuries are rarely treated correctly in emergency rooms, according to new research. They say the most frequent problem is with the splint. It's either a combination, which is a combination of a fabric and a rigid material used to stabilize a broken bone. A pediatric orthopedic team at the University of Maryland School of Medicine examined the splinting techniques used in 275 young adults or young patients, average age about 8 years old. 93% of the cases, the injury had been wrapped improperly, according to the study that was presented at the American Academy of Pediatrics conference. They say the team found that often the splints were too tight, or that an elastic bandage mistakenly was applied directly to the skin, which resulted in swollen fingers, blisters, and skin ulcers. Sometimes the kids had a pain that was far away from the site because the incorrect splinting had put pressure on nerves. Half the cases, the splints were the wrong size, either too long or too short, which meant either the bones were either too immobilized or insufficiently supported. According to the lead author here, Joshua M. Abzug, he's a pediatric orthopedist and assistant professor at the University of Maryland. He says splinting mistakes did not result in major complications that required surgery, but the issue nonetheless should be addressed. Said, I feel strongly that this is not acceptable. There's a proper way to do a splint, and even if there are minor complications, doctors and healthcare workers should do everything in their power to avoid them. So once again, doctors making mistakes all over the place. Can't even get a splint right. You see on those old westerns, they used to get the splint right with a couple of sticks out in the wild.
Yeah, you're better off with an Eagle Scout for the most part than you are splints. From a doctor in an emergency room, because there's not a lot of money in that. They want to get you in and out of there, and so especially kids, they don't look at them as having real good problems like older people with heart attacks and strokes and things like that, where they can really dig in and make some money. And so kids, they just slap something on them and throw them out the door. And this guy's exactly right. 93% of the time, they do it wrong. You would not tolerate that for your car. Why do you tolerate that for your kids? Okay, and so definitely you want to be in there when they're putting on a splint on your kid if you take them to the emergency room, and you want to get a hold of that book, God Bless America. It'll teach you how to deal with trauma, how to splint fractures properly, how to deal with open wounds, and so forth. God Bless America, the book. We need to do more of these sort of emergency things ourselves. Immobilize that bone if you get a fracture, even suspect a fracture. Immobilize it before you take them into the emergency room, and that way you're going to protect them on the way there and say, hey, I'm an orthopedic surgeon here. I'm not happy with just the emergency room doctor, particularly if they're an intern or resident or the doctor's not around and there's a nurse practitioner and stuff. Unless the nurse practitioner actually was in the military in a war zone, they know how to do this sort of stuff. Okay, so thank you for bringing that one up. And, of course, this is where everybody needs that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and to learn how to deal with things themselves, and get a hold of that book, God Bless America, learn how to deal with trauma. Remember, when the bad boys turn the grid down, when the bad boys invade us from south of our southern border, when they invade us from space or from the Middle East, natural disasters, there's all kinds of wounds and trauma and fractures. from natural disasters, floods and hurricanes and tornadoes, wildfires, earthquakes. We really need to be on top of this stuff, even though you say, well, I need to take them to the emergency room. That's fine. But take care of them first. Don't splint at home. Well, stick with us. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to North Carolina. And Greg, you're on with Dr. Wallach.
Well, Greg, you're on the air.
Hello, Dr. Wallach.
Yes, sir. How can we help you today?
Yes, I got two issues. First one is by individual who's been dealing with C-dif infection for probably about 6 weeks or more. In a hospital, he was released after about 4 weeks, and about 3 days later had to go back in. And so he's in right now. He had a lot of swelling, fluid and, on him, and so they had given him a Lasix. I think they're doing it intravenous Lasix, and the problem that he's having now, the fluid is coming off, but trouble issues with diarrhea. And under the hospital care, I know it's not a whole lot we can do, but I was wondering if there's anything that these guys could be missing. How long will it take for C-dif to go away with antibiotics? And is there anything that you recommend for the diarrhea is the first issue?
Okay, usually when somebody's on heavy antibiotics, intravenously, injection, orally, for C-dif or any other hospital infection, they're going to get diarrhea because you kill off all the bacteria. So probiotics is something here. If they're conscious, if he's able to consume food, you can bring him a box of candy, right? Well, instead of bringing him a box of candy, you bring him some of the triple treat chocolate where they have probiotics in it. You can bring him the root beer belly, great little sprinkles, kind of like a candy treat. You can bring things to people in the hospital, okay? And so that's kind of where I would go for dealing with the bubbly intestines because they've been using all these antibiotics, killing off all the good bacteria. And secondly, really need some of the things you can do to support his immune system. Obviously, as soon as you can get the 90 essential nutrients into him appropriate for body weight, I would do that. Also, I would get the killer biotic, which is a blend of herbs which support the immune system. 2 of those herbs actually have antimicrobial properties, and I'd go ahead and give him 3 of those twice a day for 100 pounds of body weight. And whether he's on antibiotics or not, because, again, it'll support his immune system. But don't forget that 90 essential nutrients. Keep him away from the bad stuff. Okay, at least let's start question number 2.
Okay, and the next one is stiff knee joints. One knee was getting stiff at one point. Now is both knees. Range of motion has greatly decreased. And I'm
wait a minute. Stop. Is this you or somebody else?
Somebody else.
Okay, how much do they weigh?
160 pounds.
Okay. Well, then you get rid of all the bad stuff, all the inflammatory stuff, no fried food, no processed meats, no nitrates and nitrites, no oils, and no gluten. And then I would throw in 2 of the healthy bone and joint packs. Again, this is to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes bone itself. And he could use the CM cream that comes with those topically on the knees and any other places sore. Don't forget getting 2 bottles a month of the CM Plus capsules. Give him 3 of those twice a day and call me every 2 weeks. Back after these messages.
Let's head to Dallas, Texas. And Rose, you're on with Dr. Wallach.
Hello, Rose, you're on the air. Hi.
Hello. My question is for a friend of mine. She's 71 years old, and she weighs about 170 pounds. The problem is that there are prolapsed organs, the uterus, which they want to address with a hysterectomy. It falls out of the body, and of course she has to place it back, in. And then the case with the kidney is they want to do surgery, which is like a lift, but without a mesh type procedure.
Okay, now wait a minute. Are you talking about kidneys or urinary bladder?
We have 2 different things: the uterus and then the bladder.
Okay. Yeah, it'd be pretty hard for the kidneys to be prolapsed. Okay. All right, so here we go. What I want you to do is get a 2x4. I want you to put the 2x4 underneath the feet of the bed. Not underneath her feet, put it under the feet of the bed. So when she sleeps for 6 or 8 hours at night, her head is going to be 2 inches lower than her feet, because I want gravity to help her pull everything back down and take some of the pressure off the ligaments and tendons. I also want her to, during the day, she can go to a pharmacy without a prescription and get a little rubber device called pituitary, which she'll insert herself into her vagina to hold up the bladder, and the uterus. She can take it out at night, but be sure that she gets that 2x4 under the feet of her bed, not under her feet. Now, Shar? Shar?
If you'd like to make a call.
Hello? Oh.
Appears we lost Shar.
Okay. So basically what we're going to do here, Rose, is what I want you to do is get her on 170 pounds and have her take 2 of the healthy bone and joint packs per month. 2 healthy bone and joint packs per month. Then 2 healthy bone and joint packs per month. I want her to take 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, 1 full dose of everything else twice a day. And that's going to give her the raw materials to support and promote maintenance repair of the ligaments and tendons and connective tissue that will hold the uterus and the urinary bladder into place. Now, this is going to take some time. This is not going to happen overnight. This is going to take maybe 3, 4, 5, 6 months to happen. And so, in the meantime, if she doesn't want to have surgery, she needs to get that 2x4 under the feet of her bed so that she can sleep with her head 2 inches. I mean, if that's uncomfortable, she can put a pillow under her head so her head's level with her feet, but her feet have got to be 2 inches higher than her chest. Okay, so at least she can have gravity working on her behalf while she's sleeping for 6 to 8 hours, or anytime she lays down at night or during the afternoon take a nap, she still can do that. Also, I want her to use that pituitary so she's vertical during the day to hold everything in place. It's a mechanical device to hold everything in place. And at night she can take it out and clean it and so forth. The pharmacist will give her instructions on how to deal with that. And then, of course, the 2 healthy bone and joint packs per month. And the whole purpose here is to support and promote maintenance repair of ligaments, tendons, connective tissue, everything that's going to hold that bladder and uterus in place. Give us a call every couple of weeks and give us a progress report. And we'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie for these messages.
All right, let's head to Pueblo, Colorado. And Barbara, you're on with Dr. Wallach.
So, Barbara, you're on the air.
Okay, thank you, Doctor, for taking my call.
What's up?
I've had the shingles. It's 6 weeks now, and I'd like to know what you can do to heal these nerve ends.
Okay. How much do you weigh?
Oh, I weigh 200, and I've been taking the bone and heart pack for 6 months.
Okay, the brain and heart pack?
Yes.
Okay. And when did you first have the shingles?
Oh, 6 weeks ago.
Okay. Now, are you taking 2 brain and heart packs per month?
Pardon?
Or 1? Are you taking 2 of the healthy brain and heart packs per month or 1?
I'm taking 2. I'm taking
good.
2 scoops in the morning and 2 scoops at night.
Okay, good. Very good. Take a full dose of everything twice a day. Then, shingles, of course, are the chickenpox virus. So what I want you to do, in addition to that, get a hold of what we call Killer Biotic, kind of like Geraldine's boyfriend, Killer Biotic. And it's a blend of 8 herbs, all of which support your immune system, which is what's down here, okay? And I want you to take 3 of those twice a day. That'll be 2 bottles a month of the Killer Biotic. And they're designed to support your immune system, but 2 of those 8 herbs actually have antimicrobial properties and have the capacity to disable or kill bacteria, fungus, yeast, viruses, and so on. Then I also want you to get a hold of our colloidal silver, our Envision colloidal silver, and soak a cotton ball 3 times a day and dab it along the area of your skin that you're feeling the pain, where that tract where the shingles virus had blisters at one time. Even if the blisters are not there, you want to put the colloidal silver on it because you'll absorb a certain amount of that through the skin and have antiviral properties. But also, I would use our CM cream. You use our CM cream topically on that same location. You're going to put the Envision colloidal silver, and the CM cream will actually help you with pain relief for about 3 to 5 hours. If you prefer aromatherapy oils, we have what's called the trauma oil, which is a blend of aromatherapy oils, and you can apply the trauma oil. Sometimes a lot of people like to mix our trauma oil with the CM cream, and apply that. Very, very strong analgesic properties, very strong anti-pain properties, anti-inflammatory properties. And again, that could be a mix of our aromatherapy oil. It's called trauma oil, the CM cream. You could use either one of them by themselves or mix them together. And don't forget, you want to keep that virus load down. And so use the colloidal silver, soak a cotton ball with that, and 3 times a day apply that colloidal silver directly to the track where you're having the pain or the itch. And give me a call every couple of weeks. Let me know how you're doing, Barbara, because this that tends to work very well. Okay, Doug, let's go to callers.
Let's head to Capitola, California. And Kat, you're on with Dr. Wallach.
Well, Kat, you're on the air.
Hey, Doc Wallach. I've got a 78-year-old lady friend who has high blood pressure, diabetes type 2, and her MD told her she needs to have her parathyroid gland removed because her calcium level is way, way too high, and she's not allowed to take 1 milligram of calcium, he said, to avoid calcium. And she has osteoporosis and loose teeth and arthritis, and she's worried about the Coumadin she's taking. She knows it's a rat poison, but they've told her that any calcium or the Beyond Tangy Tangerine will be a bad thing because she has high blood calcium due to the parathyroid gland, which she wants to remove.
Okay, the first thing she needs to do, the very, very first thing she needs is fire this doctor immediately. This doctor does not know anything about physiology. When you have an enlarged parathyroid gland and you have high calcium, it's because you have raging osteoporosis. Didn't you say this lady has osteoporosis?
Nope.
Did you say yes or no?
Right. She has osteoporosis. Her teeth are loose. Her gums are receding. Her legs, yeah.
It's a sarcastic question because I heard you. Okay, but I want our listeners to understand that she has osteoporosis. That's why her calcium is high. If her calcium is high and she has osteoporosis, where is her calcium coming in? Doug, did Shar get back on here?
No.
No, okay. Well, what happens here is, Kat, when you're not taking in enough calcium in your diet, or you're not absorbing it because you have a gluten intolerance, or you have not enough stomach acid to absorb the calcium, what happens is your parathyroid glands enlarge and start overcompensating, pulling more calcium out of your bones, which tends to lead to fractures and all that kind of stuff. She needs to find herself another doctor immediately, and I would have her call him on the phone and ask him, I've got enlarged parathyroid glands, I've got very high calcium in my blood, what do you think I should do? Oh, you got your parathyroid removed, click, parathyroid removed, click, parathyroid removed, click. Well, you have osteoporosis, we need to have you take more calcium. That's the one she wants an appointment with, okay? In the meantime, what does she weigh?
She weighs about 180.
Okay. Well, she needs 2 healthy bone and joint packs per month. And then additionally, that'll allow her to have a 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, 1 full dose of each of the products there twice a day. That'll be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Plus as a breakfast and dinner. All that will be accomplished by the 2 healthy bone and joint packs. But also for her high blood pressure, I would have her take the Ultimate Daily tablets. So she needs 3 of those twice a day. It'll be 1 bottle a month of the Ultimate Daily tablets, and that is to support and promote healthy blood pressure. It'll support and promote healthy. Let's see here, blood flow through obstructed arteries. And how tall is this lady?
Oh, about 5'6", 5'7".
Okay. And for her diabetes, I also want her to get 2 bottles a month of the Sweeties. I want her to take 3 of the Sweeties at breakfast and 3 at dinner time. Make sure she's going to take her fasting blood sugar before she medicates herself every day. And as her blood sugar drops, she needs to take less and less medication as her doctor instructed her to do. Okay? And, her doctor is giving her very, 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 very bad advice. Okay? This person has forgotten his basic freshman physiology, and she needs to fire him immediately. Okay, give me a call every 2 weeks. Let me know how this lady's doing, and I want to talk to the next doctor that she hires, okay? I need to talk to the one she hires, and he really should know physiology of parathyroid glands. Okay, Doug, let's go to callers.
All right, let's head to Texas, and Scott, you're on with Dr. Wallach.
Oh, Scott, you're on the air.
Yes, I've had a continuous fluid coming from my eustachian tube. The doctors call it eustachian tube dysfunction. It's been going on for quite a while now, and I've taken pulsatilla, pseudoephedrine to try to help it drain better, and lots of the supplements as far as the bone and joint pack.
Okay, well, stop a minute. You say your eustachian tube draining into your throat or draining out of your ear?
It's draining into my throat.
Okay, hang on. We'll be back. Get your pen and paper ready, sir. And I'll ask you one or two more questions, and I'll give you a plan after these messages. We're back. It's Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 95 Crusade. And Doug, let's go right back to Texas and Scott. Okay, how much do you weigh, Scott?
I'm 170.
Okay, how tall are you, sir?
6'1".
Okay, great. Do you have any history of anything like asthma, bronchitis?
No, never have.
Okay. Do you have any history of anything like skin problems, eczema, dermatitis, psoriasis, or rosacea?
I've had skin problem. Yeah, it's a pulsatilla, or not pulsatilla. It's a skin problem related. It's porokeratosis is the name of it. Yeah.
Okay, keratosis. Okay, I'm very familiar with that. It's actually a vitamin A deficiency that's caused by malabsorption. Now, do you ever have any bowel problems, diverticulitis, irritable bowel syndrome, constipation, diarrhea, anything like that?
No, I haven't, no.
Okay. Well, I think you have an underlying problem, particularly with the history of keratosis. I want you to get off of all gluten, no wheat, barley, rye, and oats. That would include the dog and the cat and the bird and the fish and the spouse and mother-in-law. Everybody living in the house, because of cross-contamination in the laundry, the couch, everybody's watching TV, food preparation services, beds where you sleep. Everybody's got to be gluten-free. No wheat, no barley, no rye, no oats. 0, 0, 0. Okay, and again, no fried foods, no processed meats, no oils, and no gluten. Then that's going to help a lot for the inflammation resulting in your eustachian tubes producing all this mucus dripping down in your throat, causing you, usually it'll cause everything from a cough to irritated throat and so forth. Then, at 170 pounds, we're going to kind of cover the waterfront here, and I'd suggest you take what we call the Healthy Brain and Heart Pack. The Healthy Brain and Heart, that's the shortest way for me to say, because this is our last segment here, I've got to go quick. It's the shortest way to say everything I want you to take. 2 Healthy Brain and Heart Packs per month. That'll be 3 of our Ultimate Selenium at breakfast and dinner, 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All that'll be accomplished by the 2 Healthy Brain and Heart Packs per month. The whole idea here is to support and promote maintenance repair of all systems in your body, including your immune system. Also, we actually have what we call the CM Plus capsules, which are an anti-inflammatory analgesic soft gel capsule. You could take 3 of those 3 times a day. It'll be 3 at breakfast, 3 at lunch, 3 at dinner. And it'll be 3 bottles a month of the CM Plus capsules. And again, it's analgesic, pain-relieving, anti-inflammatory, anti-swelling, and so forth. Once all the symptoms subside, I'd cut that down for a month or 2 to 3 of the CM Plus capsules at breakfast and dinner. So you're going to cut by 30%. And after a month, if the symptoms are still gone, I'd go ahead and cut it down to 3 a day, 1 at breakfast, 1 at lunch, 1 at dinner. There'll be 1 bottle a month of the CM Plus capsules. And usually after 2 to 3 months, you're able to wean yourself off the CM Plus capsules because you've been on a gluten-free diet long enough to deal with the basic underlying problem here. Okay, so again, no fried foods, no processed meats, no oils, absolutely no gluten, no wheat, barley, rye, and oats. It's a major and common problem. And usually doctors will give you antibiotics and all that kind of stuff, and you might get some sort of superficial results, not really dealing with the problem because it's a deeper, deeper problem. Give me a call every couple of weeks, if you would, please, Scott. Give us a progress report or lack of progress report, and we'll walk you through this. Okay, Doug, how much time we got here?
About 30 seconds.
Okay, 30 seconds. I want to invite you, if you want to live to be well beyond 100 chronologically, get a hold of my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Rare Earth Forbidden Cures, and the book Immortality, and learn how to add 25 to 50 healthy years to your life, biologically 30, 40, 50. You can do it, and this is kind of like magic, right? You're going to do what the top 20 longevity cultures do. They have 40 times 100-year-olds we do. They have 100 per 250 of their population. We have 100 per 10,000. It's very simple. This is stuff you can do at home once you have the information. Get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Get a hold of the book Rare Earths and Cures, and the book Epigenetics. And contact Young Diva Associate, and they'll walk you through this. You'll be amazed at what you can do to add those healthful years to your life. And, you know, you want to get this information to your siblings, your brothers and sisters. Get this information to your kids and your grandkids. Why not? Once you're around for 200 years, and you can make it. Thank you so much, Shar, for giving it a shot today. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops, and God bless America.